The next context is preventable chronic illness. And this really, really is of concern. I love this slide. Watch this. This is the best slide that I have in the whole thing. There is a storm of preventable chronic illness washing over a delivery system that we cannot afford. Isn't that good? Thank you very much. I did that. Actually, if you like it, I did it. If you don't, my assistant did it. But the point being is, look at the curve of preventable chronic illness. One of the things that you need to be really, really attentive to is how many people smoke in the great state of Connecticut. How many people get exercise other than getting up and going to work in the great state of Connecticut? How many people are obese? How many people are diabetic? How many people have the fundamental risk factors for a preventable illness? You are paying a huge bill for preventable illness. The magnitude of it is overwhelming. And the medical care system is more than happy to throw the most expensive assets in the world at it. So what you will see is absolutely, if you go to America's Health Rankings, and I do want you to go to that, so you should write down www.americashealthrankings.org. My young staff people hate it when I go www. Because it makes me sound like an old fogey. I say www. to give you time to get your pencil out. And you can write down America's Health Rankings. You're number 7, though, so you're pretty good compared to other states. Connecticut actually is a healthier state than most other states in the country. But we will list for you out of 20-plus measures, which are very broad, what's going on. But here's the deal. If you try to get a public conversation about the things that are killing you in your county, it is very difficult to do it. If you try to organize community groups and so forth, but the Chamber of Commerce is always willing to have a golf tournament for the Little Sisters of the St. Elsewhere. And who could be against the Little Sisters of the St. Elsewhere? But are the Little Sisters of the St. Elsewhere focused on the fundamental things that are causing unnecessary hospitalization and emergency room visits by the people that you're paying the bill for? Are they really focused on the fundamental things that you really got to get done? Probably not. So there needs to be a data-driven conversation that you have to lead through the Chamber of Commerce, through the civic association, through the mechanisms of power that's focusing in on a data-driven community engagement around health. And I really, really, really can't push that enough. So you'll see the things. We are living longer in America. Death rates for heart disease are going down. Death rates for cancer are going down. Go ahead, America. We kicked cancer's butt. We kicked heart disease butt. Death rates are going down. Yes, they are. But guess what? The number of people with those diseases are going up. And they're going to live forever. And you can't afford it. It's better that we go ahead and try to eliminate the problem on the front end. Private sector, business leadership, if there's anything I can say to you today that I want you to get more, you've got to get your head in the game on this. And you guys are phoning it in. So if you want to keep paying for it, go ahead. Fragmentation in care delivery is the last big context for me. And that is, as we are living longer with chronic illness, it means we need a lot of stuff. A lot of it is in medical. It's medically necessary social support. And so somebody's got to put the puzzle together. So you get these people who are, like this woman who I took care of, who had a chronic illness. She had diabetes that wasn't diagnosed, led to a peripheral nerve disease, causing her to live in a wheelchair. She had high blood pressure, wasn't diagnosed, gave her congestive heart failure. That's why I have the blood pressure cup up there. She had 3-4 doctors, none of whom were connected by any common information system. So people were over-treating her, people duplicating medication, no connection at all. We discharged her to home, didn't pay attention that like so many seniors, she lived alone. And in her community, the Meals on Wheels program, see the refrigerator with wheels on it? I did that. I'm so proud. We do try to do Meals on Wheels. It's hard. The Meals on Wheels program was cut back in her town, so she wasn't getting a hot meal, so she wasn't eating. The home health care aid program was cut back, so there was nobody to transfer her from wheelchair to bed and back and forth, so her hind parts broke down. She got an ulcer. She couldn't fight off the ulcer because she wasn't eating, so she was catabolic. We told her to come back to the hospital 3 Wednesdays at 1 o'clock, except the mobile van that carries wheelchairs doesn't run Wednesdays at 1 o'clock, so she missed her appointment. So now she's sitting up in the apartment, sick, septic, scared, miserable, a great American woman, lovely lady, by herself, alone and isolated in America of 2013, back then. We sent her, she came back to the ER by ambulance. We redid everything that we had done before and more. She represents the reason why your Medicare budget is broke, because the leading cost curve for Medicare is readmissions back to the hospital 30 days after admission for congestive heart failure. This is the story.